NRAC's website probably in a week or so. It usually takes a little bit of time. And when everyone is speaking, if they could make a reasonable effort to identify themselves, so that helps people determine who's talking. So I will say I'm Rick Rothstein. I'm chair of the North Region RAC. And it's now 5:02. This is the March 15th, 2023 meeting. So my printer is kaput, so I don't have a copy of the agenda. So if someone can prompt me, that would be good. So we do have an introduction, some introductions to make. Stacy tells us we have our new Assistant Regional Director for Private, and a position that's been unfilled for, well, Stacy has filled that position as well as Regional Director for the last year, roughly. So why don't we start with that announcement? That would be good.
Yes, I am pleased to introduce to you Dawn Fry. She has come from the private sector to join our team, and I can't explain how happy I am to have this position finally filled. I could wear one hat right now, so please feel free to forward any topics or any concerns. I can really focus on one job now. So now I introduce Dawn Fry.
Good afternoon, or actually evening, everyone. As Stacy said, my name is Dawn Fry. I worked in the private sector for 28 years. Happy to come into this side of the table. I have a nephew that has autism, and since I was a young girl, I had a friend with Down syndrome, and that's kind of what got me into the field.
Mm-hmm.
So I've worked in all facets. I was a direct support professional. I was a house manager. I was an executive director. So here I am now. I come with a lot of information from the private sector. However, I am learning the DDS side of things, but I do have I have a good ground, background with regards to the department. So please feel free to reach out to me. I'll put my email and my cell phone in the chat so that if you need to get a hold of me, you can reach out.
Yeah, well, it's always great to have experienced people come into the department, and vice versa, experienced people come into the private providers. So we can call this the player to be named later for a person who left central office to join my private provider agency a couple of years ago. So it's kind of a swap. We took one, now the state's taking one back, so that's good. Anyway, so this is Rick Rothstein, chair of the RAC, and Nick, why don't we go around and introduce the members of the group? So I'm Rick Rothstein. My son is Spencer. He lives at the Asylum Avenue group home run by HARC. He is 40 years old. He's been in a CLA for the last 32 years. He was an emergency placement largely due to medical complications. He's very medically complicated. His behaviors, thanks to the good work of everyone who's helped him over the years, are much better. But he still does not understand safety. He has autism and ID. Medical issues. So we're very thankful for everything that he has because of what the department does and what the legislature funds and the governor signs. So I'm also on the Council on Developmental Services, and I've been on the RAC for, I don't know, 5 or 6 years, something like that. So I also served as the chairman of the board of HARC for 4 years and was on their board for about 15 years. So that's enough from me. Tammy, why don't you go ahead? You're muted.
Okay, I'm Tammy Salinger, and I have 2 kids with Fragile X syndrome, And my son Brian is 30 and he lives in a JCL group home in West Hartford. And he was out of district and out of state for most of his school years residentially. And my daughter Jody is 33 and she is at home with us still. And she is not in a day program. We self-direct. So she has a job coach that's out in the community with her and she volunteers she's got about 10 positions that she does throughout the week and some are as needed. And she had a very good job coach to start with to get her going with it, who's on this call as well, Donna. So Donna Cohen. Anyway, so I've been involved in NRAC for quite a while also where my husband and I are the co-leaders of the Connecticut chapter of the National Fragile X Foundation. That's who I am.
Okay, Susan. Susan's probably our newest member.
I am, and I don't have nearly an impressive resume as Tammy or you, but my name is Sue Prehar. I have a 25-year-old son who is severely autistic and nonverbal. He is currently at a group home in Wyndham run by Whole Life Inc. It's not going well, as many of you who have been with us know. But I am incredibly happy to be part of this organization. I love being part of this meeting. Everything about it is super important, and I am very grateful that we do these committee meetings. So I say thank you to everyone for taking your time.
Well, so this is Rick Rothstein. Sue, everyone brings something different to this. Yeah, we have family experience. All of our kids are different, and you are a valued member of the group. So, Kim, why don't you go ahead?
Hi, I'm Kim Little, and I live in Tolland. My daughter Ellen, who is also on this call, is 31, and she has a genetic syndrome, Soto syndrome, and she has an intellectual disability. I'm also on one of the North Region NEF program, and I also am representing the ARC on this in this group. I work for Creative Living Community of Connecticut. I'm the farm stand manager, the jack of all trades.
Rich, you want me to go now?
Yeah, go ahead.
Okay, I'm Ellen. My mom is on this call too, Kim. I work 2 jobs. I work at Home Goods, and I work at a nursing home. In the kitchen. No. In the laundry room. I'm currently getting supported by Mark Inc. of Manchester. As my mom said, I have Soto syndrome, and we're not, I'm on my phone at my friend's house and my mom's on her computer. So we're in different places. And I apologize that I came in late, but I couldn't get on. I had to wait until Teams will load on my phone. So I'm here. So yeah.
Yes, Ellen, we missed you. I think last month you were otherwise occupied, but we're glad to have you back.
It's good to be here.
Yeah, thank you. So, Donna?
Hi.
Donna, I'm sorry, we have 2 Donnas.
Oh, sorry. I'll wait.
Go ahead. Donna Clausen, would you like to go first?
Sure. I'm Donna Clausen. I'm the mother of a 38-year-old daughter who is supported by Seabird. She works at the Village Bakery. I've been on the RAC for a good number of years. I don't remember exactly how many, but quite a few. And I guess I worked for the department for 40 years before I retired from DDS, and I'm currently local coordinator for Mansfield Tolland Special Olympics.
Okay, now the other Donna, whose initials are also DC.
Hi, this is Donna Cohen. I have a 30-year-old daughter diagnosed with autism and an intellectual disability. And I just had my last subcommittee meeting with the employment group that have been going on. It has a long name and I can never remember it honestly, but it was really, really, really an interesting, really one of the more interesting things I've done. It was really great. The people, most of them were working for the department. So I was one of the parents on the committee. And I have to say, if you ever have the opportunity, you know, they ask people to hop on these things. Fascinating. Super nice people too. So it was a very good experience. Rachel, right now, I pulled her out of her program when COVID started because we couldn't really work it out. It was just too complicated for her. And so we've been private hiring 3 days a week. And then the rest of the time, it's me. So one of these days, by the way, I'm going to make it to see Kim and Ellen over on one of those days. I'm so determined. I just can't seem to do it yet.
You should.
I'm really going to try. I know you and Rach know each other, so that would be fun. And the other thing I am interested in that I hope at some point we're going to talk about, maybe legislative, is expanding the I don't know what the word is, expanding who in the family can get paid for taking care of their child, because, you know, I have no income now. So
It's on the list.
it's on the list. Okay, I thought it was sort of a legislative thing, right? So
Well,
I'm really
it's
hoping that.
legislative, and it requires a modification of one of our DDS Medicaid waivers. Yeah, which
Got
is just a paperwork thing that takes some time, but the Human Services Committee did pass that bill out of committee, and it's in appropriations. And what the cost is, I think in many cases it's going to be the same or less as being in a private provider program. So I don't think that it's going to get stopped by the so-called fiscal note, which kills many legislative efforts. So having been the victim of that several times in the last 10 years, it's sometimes bills get massaged so they don't have a fiscal impact, but that often lessens their impact in real life. So I think the chances are pretty good that's going to pass in probably 6 months to 9 months to get the waivers amended. So it's on the horizon, I would say.
Okay. Yeah, it was very sad. Somebody said, well, just give up your guardianship. And I was like, really? Wow.
Yeah,
So
everyone
okay.
except the guardian can get paid.
Yeah,
And,
I heard this, but
I think the bill number is 5765, but I will check that.
okay.
So
Well,
it's
thank
over
you
the
much.
appropriations. Thank you. So Cindy?
Hi, I'm Cindy Licksteiner from Windsor. I feel very privileged to be part of this group. So I thank you all for having me. I've learned so much and I feel so much more at ease now. Having a little bit of background of how the whole system works. My husband and I have a son, Brendan. He's our middle child. He's 47. He lives in a group home sponsored by FAVAR in Avon. Unfortunately, he's not working right now. He worked at Cigna through a HARC program for many years, but during COVID, it was shut down and it hasn't been reinstated. So that's a concern, but he does have a day program, a good one, run by FAVAR. Brendan has IDD and he's also autistic. He was diagnosed quite young. He's been in special ed since age 3. I don't know what more you need to know. I don't know what more to add to that. You all have such a nice background in, interesting background in social services. That's not my fort, but I'm learning. So thank you for having me. And I want to thank Rick for being such a wonderful facilitator to our group.
Thank you. You have the most important qualification, and that is that you are the parent of a young man with intellectual disability. That's really what's required here. So, or
Thank you.
autism, or both. So, we're glad to have you. And a lot of employment sites have not reopened. I think one of my son's housemates had a position at Cigna that also has not reopened. So it is very sad that some people have been frozen out for now under the slow reemergence, slow decline of COVID, and companies in some cases making different business decisions. So we will see what happens. There is legislation to address that too. So we will see. Lori?
Hello, everyone. My name is Lori Coughlin. I'm a parent of a young woman. She's 35 years old. She's actually just turning 35. She is on the autism spectrum. She also has a undiagnosed syndrome, so she basically falls in that spectrum disorder. She also has intellectual disabilities. She is currently in a day program in Windsor, which is Family Partners. It's strictly community-based, so she's out and about every day. She also is in a CRS in West Hartford with 2 other young women, and that's going very well. That's run through HARC. I sit on the ARPA Housing Committee, which is fascinating, really interesting. I've learned a lot about creative housing, and that's kind of my pet peeve. I'm very interested in that. I've also served on the RAC for probably, oh gosh, maybe 8 or 9 years. Learned a lot. It's a great group of people. And Rick, thank you for all your involvement over the years. It's been a learning experience. You've had so much to share with all of us. I think that's me. That's my story.
Yes, Lori's daughter is one of my neighbors. I live about half a block up, block and a half up from where her daughter lives, on Newington Road in West Hartford. So one of these days I'll get over there.
Yeah, you definitely have to come.
It's too
visit.
far away.
Yeah, it's totally not too far away.
So,
We'd love to have you visit sometime.
Okay. Thank you. Thank you, Lori. And Annette Skelly?
Hi, everyone. I'm Annette Scully. I am a parent of a 31-year-old home and has a work that we're very happy with. Presently, he is in the transition program list for housing. I'm very grateful again for this committee. With you, Rick, you're just a wealth of information. Appreciate everything you bring to the table. I'm vice chair for the RAC, and I've been on the committee probably the same thing, 8, 9 years. So welcome aboard, Dawn. So happy to have you.
Okay, I think I got everybody, but if someone has not yet identified themselves, please take the opportunity to do so.
Have Mary Lou.
Okay, hi, Mary Lou. How are you? I saw ML down in the tray here, and I was trying to figure out who that was. So, Mary Lou, do you want to tell us a little about your daughter and her situation?
Is there another Mary Lou? This is Mary Lou O'Connor. I don't.
Right, that's what
Oh, here you are.
that's what I was addressing was you, Mary Lou O'Connor.
Oh, okay. Because that was not me speaking before, but I
Oh.
did just find it. I saw my camera's off, but I can speak. I'm the mother of a 53-year-old woman who has was home with us until she was 45 years old. There wasn't funding that would meet her needs at that time until the legislature allocated funds for, I think, 100 families where the parents were over 70. So we were fortunate to have her have the opportunity to go into an apartment. It was fairly nice in many ways, but when COVID came, it did not meet her needs. She's currently living in a Hark group home in Bloomfield, which is very well run, very well. She has a wonderful job at Hark, the artisan studio, enjoys it very much. I think one of her major stumbling blocks seems to be ADA. I have enjoyed learning a lot about what the system is all about, and I also appreciate Rick taking the helm because you have a lot of information to share, and I appreciate learning. That's about it. Ann Margaret's fairly stable right now. She's getting, Hark has been able to establish a good medical program now. So that's a very big concern to me. And grateful for that. And thank you.
Thank you. And I guess we have another Mary Lou
That's
who was speaking before.
No, I don't think so.
Okay.
Adriana, I think, is the last person.
Adriana, we know you, but could you introduce yourself for Dawn, please?
Hi, good afternoon, everyone. This is Adriana Ramirez, and I am with Connecticut Family Support Network. I'm also a relative of several family members with various disabilities, including intellectual disability, Down syndrome, autism, and mental health disabilities. So I'm happy to be here to listen, learn, and support in any way I can.
Well, Adriana, you were complimented last Friday by the commissioner in his testimony before the budget work group of appropriations, the health work group, for facilitating a lot of the translation services over the last couple of months here with all of the open forums and whatnot. So thank you very much for doing that. That's one quality that none of the rest of us have. That I am fluent in English and Spencerese. That's the language my son speaks. And beyond that, yeah, I'm not very helpful when it comes to language. So I think that covers everyone. Moving on in the agenda. Which I don't have in front of me because my printer's broken. I think legislative report was next. That could consume the next hour and a half, so I will try to keep it short. This is the most exciting year. I've been doing this for over 30 years. And since my son was about 3 years old. And this is the most exciting year for legislation possibilities in all of those years put together. We have a group of legislators on the Human Services Committee that is absolutely determined to get things done that we have all wanted for a long time, such as what we were talking about earlier with Donna Cohen and paying of guardians. They have taken the step to move that forward. They are working at the Speaker of the House's direction on a bill numbered 5001, which I know a couple of you testified on in writing. I was up there last Thursday. for that and for the budget appropriations hearing. So it was a very full day. I don't think I've recovered. And this bill has, I believe, as of today, 12 sections. And each one of the sections is major. One of them is dealing with transportation. Most of these are studies. It requires the administration to, in the next up to a year, some are much shorter than that, to look at various issues. One is the transportation issue. That's going to be done in cooperation with the Department of Transportation, looking at affordable and free, if possible, varieties of transportation for all people with disabilities. And I know living in West Hartford, that's not a big problem. But for people out in Holland, for example, I know that is a big problem. And some parts of the state are even worse. So this is a statewide initiative, and the chairs of the committee and Speaker Ritter have assured that all of the committees of the legislature are going to work together on this to make sure it happens and to be as comprehensive as possible. They've been using the term omnibus bill. Omnibus bill means a whole bunch of things thrown together. So that's sometimes bad news, but I think in this case it's good news because it means we can go all out advocating for this between now and the end of the session and not have to worry about 10 different bill numbers. The bill is HB 5001. It's the #1 bill in the priority of the speaker this year. So that is item number 1. Item number 2 on the list in this bill is a broadening of the autism waiver. Right now, there's if you have autism in Connecticut, you can be functionally unable to do anything in your personal life, and you are not eligible right now for DDS services unless you have an IQ of 69 or below. The autism waiver is something that's designed for people who have higher IQs, but it's very limited services. It's limited to an amount of $50,000 a year. Like all of our programs, except CFC, these are not entitlement programs. So they require specific action by the legislature and specific funding. If there's a program and no funding, there may as well not be a program. So with the autism waiver, there are approximately 300 slots that are authorized by the Connecticut General Assembly and approved by the Center for Medicaid Services, Medicare and Medicaid Services. The bill includes a provision to expand that by 600. So there would be 900 and 950 slots instead of 300 or so slots. And like many of us are experiencing in the private sector, DSS is very much behind in approving people to actually receive services. You go on the waiting list for the service with a fairly simple application, but there's a more thorough application and review when your name comes up on the waiting list. The waiting list, I'm told, is over 2,000. So 600 is a start, but there's going to have to be more. And I probably should say at the beginning of all this, I probably should have said that there is virtually no opposition to any of the provisions of this legislation. The providers are on board. I think the department is on board, although there's a lot of work to do, and obviously funding is going to be an issue at some point. And the advocacy groups are on board. Do we have some differences? Yeah, we have some differences. But some of those are going to be worked out in the studies over the next period of time. And another major piece of this is workforce development. Now, we have big holes in our workforce in the private sector. I think we all experience that. And we have big holes in some places in the public sector. Certainly, if we're going to expand the autism waiver to more slots, we're going to need more people at DSS reviewing these applications and moving them along. Because actually right now, although we authorize for over 300 slots, there are only 219 receiving services because there's a backlog in getting those applications processed. So there's a workforce development program that's being coordinated with the Department of Labor and so forth. And it's the idea is to develop a pipeline for people coming out of school and into the various fields that we need them. Certainly we need more direct support professionals. We do need more nurses. We need people who are interested in BCBAs and other behavioral specialties. So it's my youngest daughter became a special ed teacher because of her brother. And she saw what the school system did for him, and starting at age 8, when he moved into the CLA, saw what the group home did for him. And so she decided to go into special ed. And she spent her first 6 years teaching at the New England Center for Children, which is one of the premier spots in the world for learning about how to help people with severe autism. So she's now working in the public schools. There's also a workforce development segment to deal with getting more of our individuals to work. My son would love to work. We would love for him to work, but he has his limitations. And we need more opportunities in order to have people like Spencer be able to go out and work. One piece of that is a tax incentive program, which they're working on with the Finance, Revenue, and Bonding Committee to give employers incentives to hire our folks, and an education program to teach employers of the prospective benefits that they would have from hiring our people, our family members, and their colleagues. So that's yet another piece. There's a effort to, and I'll use the word that's in the bill, ameliorate the waiting list for DDS services. Ameliorate does not mean eliminate. It's not practical to eliminate the waiting list. But we do have about 72 people on the emergency list right now, and several hundred on the urgent list. And the biggest problem we have right now, according to Commissioner Shepp, and I think we would all agree, is people. We don't have enough workers to do this. So even though there's slots available in existing residences, providers can't take on some of those people because they don't have enough staff to support them. We also have the round peg and square hole problem, is that you have a house with, say, 3 individuals who have very severe behavioral issues, and say they're males. It's hard to take a 25-year-old young lady and put in there who doesn't have behavior issues. So part of what's contemplated under ARPA is doing some consolidation, and the committee recognizes there's going to be a need for new housing, both CLA, CRS type, and of course supported housing, which has been so successful with the FAVAR program and the HARC program in Hartford, and the one now that's just opened on New Park in West Hartford. So there's a provision for some bonding for that in this bill. There's but we now have a census. It's been in place for 5 years. I'm very proud to be part of that effort to put that in place. It has a lot of data, and Business analytics has all kinds of ways over DDS of analyzing it and summarizing it. And the committee, Human Services Committee, wants to know where there are vacancies, where there are needs, and trying to match up people with, you know, spots with people who have needs. And, you know, once we solve the labor issue, which we really can't do any of this without solving the labor issue, moving forward with that. So that's another piece. There's a voluntary program to register people. So in the event that they get lost, developing a technology application or finding one that you could use to help track a person in the event they get lost. And there are things that exist already, although some people don't. Some of our folks, you know, I don't think we could trust my son with a cell phone. But there are other means of staying in touch. And although he's in a group home and always closely supervised, he has line of sight supervision. Do sometimes wonder what would happen if he wandered away. Clearly that would be a problem, but it can happen. So those are the biggest parts of it. I'm probably missing a couple. But
Rick, I'm
yeah,
pretty concerned. This is Sue. I'm pretty concerned about the aspect of the bill that says that if an agency has extra money at the end of their budget year, that they get to keep it. Is that still in? I mean, I could be wrong. Is that still in
that's in a
5001?
different bill.
That's in a different bill. Which bill is that in?
6612.
6612.
Yeah, I share that concern that it's inconsistent for providers to be pushing for that, although they've been pushing for it for years, to be pushing for that when everyone is complaining that we don't have enough money to pay our staff. So,
or that we have a problem with staff turnover, and one of the factors is that they're not getting paid enough.
Right, or the benefits aren't good enough.
Or the benefits aren't good, right? So that's 6612. Thank you. I was confused.
Yeah, and that is actually today's Wednesday. Tomorrow, that is being sent from the Human Services Committee to the floor, which will probably send it to appropriations to determine what the fiscal impact is. Probably not easy to determine, but it's not going to save the state money. Yeah, the most controversial piece of the bill, which I didn't get to, is a redefinition of who is eligible for the DDS waivers in DDS services. Right now, if your IQ is over 69, except in very rare circumstances, by special exception, you are not eligible for services from DDS. And this is something that I've supported the 69 IQ to the death for years because it is quantifiable. Now, in some cases, the IQ tests don't truly measure what the person's abilities are, but it is sort of an absolute. It's somewhat scientific. There are advocates that have been pushing for a redefinition to look at more of a functional ability test. So someone who might have a very high IQ, and there was someone who several people who testified at last Thursday with these situations. One individual had an IQ of 128, but he's functionally unable to function. You know, he's currently living at home, but he needs substantial support and likely above what the autism waiver could provide to him. There are people in our corrections facilities that have issues as well. And the question was raised whether those individuals who will eventually come out, are they planned for on the waiting list? And I would say probably right now they're not, because the waiting list is administered by questionnaires by the case managers. And if you're in a corrections facility, you don't have a DDS case manager. So there is an effort to expand it. And obviously there's a major fiscal impact to that. My testimony, which is being fiscally conservative, is you have to be very careful about how you redefine it, because you have to consider what the impact is, how many people are going to get in, and what's the cost going to be. So I think you can set up some conditions above and beyond the 69, in lieu of the 69, and do allow people that are functionally unable to function in, but we can't obviously let everyone in. And considering we can't take care of the people we have now adequately because of staffing, that has to be figured in as well. So that's going to be studied. The commissioner is and deputy commissioner are both in leadership on national organizations, and they are getting information from those other states to see what they do. It's been said that we are one of only a few states that use a hard and fast 69 definition. And I guess that'll come out in the wash here over the next several months as that's looked at. But I would say that's what I am most concerned about, is how that's done and how wide the door gets opened when you have a large number of people on the residential waiting list now and not enough staff to take care of who we have on the books today. So that'll have to be carefully done. It's but it is exciting. The only thing that looks like will be funded in any real dollars or request for funding in the short term is the autism waiver. The others are studies that are going to be done in the very short term, 6 months to a year. So we will have to see how it goes. If you have, the committee is still open to hearing about specific needs. And Senator Matt Lesser is the chair of the committee. Jillian Gilchrist is the co-chair. There are House members who are really steering it mostly, and that's Jay Case for the Republicans and Lucy Dathan for the Democrats. Lucy is from Norwalk and New Canaan. She happens to be the state rep for Wynn Everts, who's the CEO of the ARC. And Jay Case is from Torrington. He has been very active over the years. Can't say I always agree with him, but I can't say I agree on everything with anybody. Jay is heading it up for the Republicans, and he had a brother who was in the system for many years, and that's how he got into this. So he served on the board of LARC, which is the Litchfield ARC, in the past, and he understands. So obviously, as we move along, there'll be a need to be in touch with your own legislators, but it's going to take between now and an expected family hearing day in early May to kind of work out the details of the bill. Right now, the bill is 15 pages, and it's likely going to be much longer before it's done. So virtually every group has volunteered someone to help out with this, and I'm sure Adriana's either you or someone else from the Family Support Network is going to be into it. I know I volunteered for it from our group Families First. Wynn is involved, Walk Lum is involved, and it's really all comers right now. That they really want to get this right, and there will definitely be spots for people to participate on these study committees because it's without the input of families, we really won't know whether something works or not. So it's a lot to chew on. It's a lot to chew on top of ARPA. And as I was telling Stacy before the meeting, just day to day right now continues to be a stretch. And we're all going to have to buckle up and get into this. And if we want to see these changes happen. And, you know, the group I'm associated with started in 2016 trying to find out how we would deal with the next appropriation similar to the one that Mary Lou O'Connor and some other people benefited from for families of parents over 70. And back in that year, DDS did not know what people wanted or when they needed it. And so our group put forward this requirement for an annual census survey of families to see, and the individuals, to see how long did they think that they were going to keep their young person at home? Was that going to be forever? And if so, were they looking for in-home supports on a long-term basis? When did they think they needed them? If they were looking for a congregate setting, when did they want or need to have that? And the three categories were refined. So there's the emergency category, which is really like yesterday. Emergencies change every day because, as Commissioner Sheff often tells us, Friday afternoon, that phone rings and it's an emergency and it has to be dealt with. And I'm sure they happen on other days of the week as well. So, my son benefited from an emergency placement, and it was an emergency. Our family was burned out after running a nursing home in our home for a year and a half, and because of his medical needs. And I have a friend of mine whose husband died suddenly in about 3 weeks, and they had considered a placement for their daughter, and they weren't able to agree as to when that should be, and so they decided to put it off, and then he died. And so the mom was left with, I can't handle this on my own. And she did have CFC funding, but CFC funding only goes so far in so many things. So she was able to work with the department and a provider to get an emergency placement. So, but they have to be real emergencies. And then there's the urgent category, which is not today. It used to have like a 1 to 3 year guideline. There's really no guideline anymore. It's kind of chipping away at it. And sometimes someone in the urgent list is a better fit than someone on the emergency list. And so there are people that do get placed sometimes from the urgent list. And then the third list is the planning list. And the planning list is 5 years or more out. That there's not, it's something you're thinking about, something you see in the future that you'll need. And, but no action really is taken on that today. We're hoping that this committee will see that we have to plan for that long-term eventuality. So if we're considering consolidating congregate settings and reducing the number, well, we may need that number in 2 years or 3 years or 5 years. And starting all over again is far more expensive than just keeping things in place. So because there are hard things to put together. So that's the legislative update. I will take any questions. I will try to get an update out to people Right now, it's the committees are trying to decide what bills are going to send to the floor or what bills have to go to appropriations. So the work right now is being done entirely at the committee level. And the most important committee for us these days is Human Services, followed by appropriations. If something makes it out of Human Services and it needs money, appropriations has to approve it as well. So anyway, if anyone has any questions, I'll be glad to take them, or feel free to reach out to me, in the ensuing weeks, and do my best to keep everyone up to date. So that's kind of where we are. So moving along, I think the next thing is Stacy's report, the regional director's report.
Hi, good evening, everyone. This is Stacy Silva Gordon, the Regional Director. I just wanted to put out a reminder for the fourth Tuesday forums that we have at 3 p.m. This forum for this month on March 28th, it's on employment transformation and ARPA funding. And April 25th, it'll be technology for optimal independence. If you're not able to sign on at 3 o'clock on the fourth Tuesday, then remember that on our DDS website, these forums are recorded. They are hosted by our Deputy Commissioner, Elisa Velardo, and she is always open to other suggestions on other topics to present as well. So if you would like to email myself or Claudia with any ideas, we will pass them along to Elisa for you. With all this.
Just note that all the old ones are out there too. So
Oh, absolutely.
You started what, a year ago, I think?
Yes.
Just about a year ago when she moved over there. So there are a lot of good topics out there. And like the employment thing we had, I think that was last month.
Yes.
I learned a lot from that. In fact, we're looking at that kind of a variation of that kind of program for my son right now. We've met with the provider and said, well, could we make this work? And they're putting their heads together. We're supposed to get together in another 2 weeks or so and see what they come up with.
Yes, so I definitely just encourage you to view those recordings if you can't join. There's a lot of participation from just individuals that receive supports and services from us, and a lot of parents and guardians participate and share their perspectives, and they're open to questions. So I always think that each forum, it just gets better and better. So just wanted to put that plug in for those forums. The ARPA committees are still meeting, and again, on our website, their goals and responsibilities and the committee members are listed with their agenda and minutes from their meetings. So please feel free to also stay abreast on what's going on there by accessing it in our website. And at this time in our region, in North Region, we haven't received any transformation plans yet from providers, but our director, our resource administrator that's in charge of contract division, he is in touch with providers. So there are some, well-intentions of providers interested in transformation and submitting a plan for our region to review. So I will keep you informed as we receive any transformation proposals from providers. And I guess that's it. Again, welcome, Dawn, and thank you for joining us this evening.
Yeah, we'll have to find something to have Dawn make a presentation on to get it really in the swing of things.
Absolutely. Bring it on.
So I will add that the ARPA meetings are recorded. You can watch them live, but there is no public participation. The only public participation is through a common email account that is on that webpage. And so just like our meeting, all of those meetings are recorded. And going back to day one, I've watched many of them. It's hard to keep up with all of them because they run in clusters. The committees meet every 2 weeks. and they usually each meeting runs for an hour to 90 minutes. So, and they pretty well stay on their time frame. So it is interesting to watch to see who it is that contributes and who is just occupying a seat, so to speak. There are many providers on there. There are on each committee a couple of families, and we thank Lori for her role on the housing committee. I know there's a lot going on there. One of the things they're looking at is a revision of the rent subsidy program. If you live in an apartment right now, many people are eligible for rent subsidy, and it's kind of cumbersome. I know a couple of people who are on it. You have to send in information every month for a check to be issued, including your utility bills and whatnot. And I understand that they're taking a hard look at that to see if the benefits can be adjusted and make it more administratively smooth, which I think is the governor's objective with everything the state does. And that's not a bad thing. That's a very good thing. I know I benefited when I had to get my license renewed, and I had lost it because of my accident 4 years ago, and so I had to go through the whole process again, and it went very, very smoothly. So that's just one example of what technology and the governor's initiatives have done. So kudos to him for doing that. So he's got the right people to get that done. So anyway, do we have any topics for future meetings we can kick around right now? Okay. I think the last item on the agenda is another attempt at an election of officers. I am back in this position because our chair last year resigned as chair in order to have her first baby, and she planned to come back. As far as I know, she's planning to come back, but just as a member, because her life has certainly changed. And I agreed to do this on an interim basis because I do serve on the council. I'm involved in an advocacy organization that is very active. And I'm also working on a special project for the council dealing with abuse and neglect. And yeah, we've done a lot of work, but we have a lot of work left to do. So, you know, it would be helpful if someone would step up and take over as chair. Yeah, I will continue to do, no matter who the chair is, I will continue to do legislative updates and contribute where I can. But short of resigning as chair, I can't really force anyone to do this. So don't make me do that. And thank you for all your kind comments earlier in the meeting. You know, we are a family. We go back a long time with Alyssa, and I remember coming into East Hartford and having our little snacks at the meetings every month. But I am in favor of keeping at least a virtual option, because it does take a lot of time to come into East Hartford from a lot of the places. The regions are pretty big, and take an hour or hour and a half to drive in, an hour and a half to drive back for an hour and a half meeting doesn't make a lot of sense. So, but are there any nominations from the floor for chair and vice chair and secretary? Why did I feel this was coming again? Everybody's buttering up early on. Um, I will contemplate my decision and let you all know. We are at a very important time, and I think the people in this group can make a big impact on what's happening with 5001 and affecting the wait list, getting transportation to be better, and everything else that's included. Your views are important because it's our families that are served. I'm a big believer that everything should have substantial user input, and to the extent our family members can do that, I think that's wonderful. To the extent that they can't, we need to be their voice and speak for what they would want if they were able to speak for it. Anyway, seeing that we're not getting anywhere on the election, I guess we should adjourn. Everyone can catch up on their sleep. Annette, I see you're not volunteering. You're
No.
probably getting ready to volunteer me again.
You're great at it. Look
You
at all
did
the
6 months
compliments
ago.
you got. You're a wealth of knowledge.
Well, I'm not going away, so I was on the RAC for a long time before I was chair in my own right, and I think Colette Langer was chair when I came on. So anyway, I guess we'll take a motion to adjourn.
I motion to adjourn.
Okay, Annette, there's a second? I guess we don't really need a second.
I'm freaking it.
Me? Okay, so I guess we're adjourned at 6:05 p.m. I guess we'll see you next month. I will do my best to get you an update, particularly on 5001. Yeah, as things trickle forward, but it's an exciting time, and everyone is needed on this. So if you have a particular interest, I know one thing that I've included in my written testimony was a comment about making sure we have programs for the most needy, most complicated. A lot of the focus in ARPA and also in 5001 is on those that are not as severely affected. And my son is pretty complicated, but I know individuals with behaviors and even more serious medical conditions often have trouble finding a place that works for them. So that is a big belief of mine, and anyway, so we'll see you all. I think next month we're on again, and may see you at the Capitol if there's anything else going on.
Thank you. Have a good night.
Thank you, everyone.
Thank you. Thank you.
Good night.
Good night.